Hai, Assalamualaikum warahmatullahi wabarakatuh to our dearest lecturer Ustazah Zainura binti Baharudin and my fellow classmates. My name is Nur Idi Zainab binti Junaidi. So today my groups, which are group 5, we're going to present about the impact of COVID-19 towards supply and demand. So here's our group members, consists of 6, which are Munira binti Shukri, Nur Amira Wahida binti Nasharuddin, Nur Hidayah binti Muhammad Tarmizi, me, Nur Idi Zainab binti Junaidi, and lastly, Saidah Syahra binti Shamsuddin. Now let's move on to the content in this presentation. So firstly, we are going to talk about the introduction. Then we're going to explain about the concept of demand and supply in general and also in Islamic perspective. And then we proceed to the main issue in this presentation, which is the impact of COVID-19 towards supply and demand. So we have the impact on medical and healthcare, impact on gold, impact on online business, and lastly, impact on food supplies. Then we also suggest some government actions in solving these issues, and lastly is a conclusion. As for the introduction, as we know, during the middle of the year of 2020, the world has been shaken by the spread of coronavirus or COVID-19, which has given a massive impact to global. So this virus has started in China and then it started to spread practically to all countries in partial throughout the first half of 2020, which led to have a total lockdown in most of the country as the government's command. So when the total lockdown implemented, a lot of business need to be stopped for a while, and in Malaysia, only the essential business can be operated, such as the food and beverages and health services like clinic, pharmacy and hospital, in order to prevent the spread of this virus. And for the other business which does not classify as essential like fashion and entertainment, they need to be stopped or closed for a while, and also the national borders also need to be closed. Furthermore, all the people around the world need to follow the standard of operation SOP, which has set by the World Health Organization WHO, such as wearing face masks, sanitizing hands, and keep the social distance within 1 meter. By this, it has profoundly impacted on health, economics, environmental, and social aspects. At the same time, there are a lot of sectors, especially the non-essential industry, experience some issues regarding the supply side, as the government limit their operations and some workers need to stay at home for a while until the case is quite stable. Furthermore, during the first phase of total lockdown in Malaysia, which is on March 2020, some essential products had a high demand. Okay, for example, face masks and hand sanitizer, because in Malaysia we rarely use it such a daily, and only in hospital they use face mask and hand sanitizer frequently. So that's why it has very high demand. So when the government's mandate to wear face masks and use hand sanitizer, a lot of Malaysian people, they rush to buy the face mask and hand sanitizer, even though the price is quite high. Other than that, Malaysians also react with panic buying to buy foods and some essential things, because this is a new phenomenon that ever happened in Malaysia.
Today I would like to talk about definition of demand and supply in Islamic perspective. According to Kurniawa 2019, the number of items purchased or required at a certain price and period is known as demand. While according to Sheikh, the number is the entity that generates demand. As a result, if there are purchasers in the market or in stores, goods or service will be in demand. Next, the price of the commodities itself, as well as the price of other goods or alternative goods such as taxis can be replaced by buses, tea can be replaced by coffee, and so on, are all factors that influence demand. In addition, Demand is influenced by factors such as income, personal preference, future price predictions, government policies, which is tax and the season. As a result, demand fluctuates a lot depending on the condition. Supply is defined as producer desire, which is willingness and ability to offer a good or service at a specific price over a set period of time. However, a supply will not be successful if it does not have the support of the producer, and the producer is important to ensure that the supply is effective. Next, in science economy, supply refers to the amount of goods or service that a producer may offer to a buyer at a specific time. As a result, supply can be defined as the quantity of an item offered by a seller in a specific market at a specific time and at a specific price. Supply has its own determining element, which is the price of the goods themselves rather than the price of the items. Non-price of the goods elements includes the weather, producer factor, price level of technology, government policy, producer aims, and future price reach. Next, demand and supply in Islamic perspective. In Islam, demand and supply have their own perspective in order to always follow the Sharia and adhere to Islam faith. Moreover, due to COVID-19, Muslim awareness of religion is declining because they are unable to perform religious ceremonies to get closer to Allah Subhanahu wa Ta'ala. Anyhow, from an Islamic perspective, the concept of demand and supply exists. In the Islamic view, the demand for a good or service depends on the halal and haram of the good or service. This is the thing that distinguishes between the concept of demand in Islamic economic perspective and conventional demand. This means that the conventional demand is more widespread, while the demand in Islam is depend on the Sharia path set by Allah Subhanahu wa Ta'ala. Based on Surah Al-Ma'idah, verse 87 to 88, and the meaning, O believers, do not forbid the good things which Allah has made lawful for you, and do not transgress. Indeed, Allah does not like transgressors. Eat of the good, lawful things provided to you by Allah, and be mindful of Allah in whom you believe. Next, according to Anim Fataj, Raghbah fil Ashai is the demand for an items against a desire according to Ibn Taymiyyah. This means that the meaning of demand in the Islamic view is more or less the same as the definition of demand in the conventional angle. However, for Muslims, their requests are limited to halal things, and it is obligatory to stay away from haram things unless they are in a state of emergency, such as not having access to food and so on. Islam also teaches that for those who live a luxurious life should always remember the lives of others in order to provide awareness of self-expenditure in daily life. Next, Islam also require for charity, paying zakat, infaq, and so on. Next, supply in Islam is not much different from conventional supply. However, it is closely related to the factors and types that will affect supply. Moreover, there is something that can be make difference in this perspective, and it comes from the philosophy found in religious value in Islam. Among them, it is that Islam is often concerned about a simple life and is always careful about halal and haram goods and service. According to Muawana, zakat also affects the aspect of supply in the Islamic view. This means for each producer or supply must implement business zakat if the revenue received or sales revenue exceeds the nisab and haul set by 2.5%. Therefore, indirectly, for those who are suppliers or sellers have performed an obligation in Islam.
Today I will present about COVID-19 impacts on the healthcare supply chain and lesson scheme. The COVID-19 pandemic showed the healthcare supply chain faults and vulnerabilities. Many actions can be taken by the industry to prevent supply chain interruptions during major events without incurring excessive costs. The COVID-19 outbreak has impacted every country, business, and supply chain on the planet. The pandemic caused havoc on the healthcare system, with overcrowded hospitals on the verge of collapsing, critical item supply chain interrupted, and federal and state agencies scurrying to provide palliative and preventative care. While governments and private firms have prepared contingency plans and stock builds, the pandemic exposed a number of crucial supply chain flaws such as PPE and testing kit shortage. natural catastrophes, acts of war or terrorism, supplier insolvency, labor conflicts, cyber attacks, and data breach are all possible causes of supply chain interruptions. The COVID-19 pandemic is unique in terms of the level of unpredictability, the durations of the disruptions, and the impact it has on multiple geographic areas at the same time. Furthermore, unlike most other disruptions, COVID-19 has had an impact on both supplies and demand for goods and service. Business in a range of industries have undertaken risk assessments and established business continuity strategies to try to establish their supply chain in response to the outbreak. Many organizations have diversified their product portfolios to adapt to changing demands, developing new things with their current resources. PPE was developed by some government manufacturers, while hand sanitizer was developed by several distilleries. Others have utilized 3D printing to make their supply chain more responsive by bringing products closer to demand. Finally, several have emphasized the significance of returning industrial facilities to the United States or engaging in nearshoring, increase supply chain redundancy, and change compensation plans accordingly to strategies offered for healthcare organizations and pharmaceutical business to improve supply chain resiliency and prevent supply chain failures during big catastrophes. Next, the impact of COVID-19 shutdowns on the goods supply chain. Every link in the goods supply chain, from producer to end user, has been impacted by recent COVID-19 shutdowns. High price and a bullish market have emerged from increased investor demand for gold combined with restricted supply. Despite supply chain constraints, gold supply chain disruptions have echoed all the way from the mine to the investor. First and foremost, productivity. Some gold mines have discontinued operations because to the considerable risk of COVID-19 exposure, reducing gold availability. Many countries' operations had to be shut down due to COVID-19 based regulatory limits. Second, the delivery, because there were fewer air routes available and medical supplies were prioritized. Strict travel rules limited gold transportations and increased delivery costs. The refinery comes next. The input for refineries is gold output. The supplies of refined gold was shortened due to a decrease in incoming gold and the end of labor work. Then there are metals machines. Traders on the other sides of the gold supply chain have reported supplies shortage and higher shipping charge. Thus, greater costs have been passed on to end consumers. Finally, there's the clientele. As a result of growing demand, lower supplies, and high costs, gold prices have risen. As the virus spreads over the world, endangering people and business, investors sought of safe haven commodities like gold to safeguard themselves from an economic lockdown. The surge in investor demand has an impact on the four major gold financial markets. During the early stage on the pandemic, the price of gold futures rose to a peak of $700 over the market price. Then there's ETFs, exchange rate vehicles, stock exchange traded investment funds. ETFs hold a wide range of assets, including stocks, bonds, and commodities such as gold. Then physical gold for commercial and financial purposes.
So I will continue the impact of COVID-19 towards online business. What we can see, the rapid acceleration of digitalization has affected many companies that were not technologically advanced before this. So worldwide digital decision make polled by Statista said that most business are accelerating digitalization transformation. So many firms who had refused to adopt their digital were put by test via COVID-19 outbreak and found themselves unprepared. But some of our business who have already advanced on digital advanced speed of digitalization have demonstrated that their readiness to the COVID-19 setting. So next we can see impact on the food supply. Food manufacturing facility have the potential to be a breeding ground to the epidemic through the various reasons. The bulk of employees are low wages worker with a lack of health insurance and paid sick leave. Food manufacturing employees seek risk coming to the work if they are experience pain in the neck that may lead to the infection. So element of the COVID-19 spread either by cool and wet atmosphere within a food processing facility. They contribute to the food chain disruption during COVID-19 epidemic is centralized food processing. So COVID-19 epidemic is it generate in a supply, the demand supply balance and puts manufacturer and entrepreneur in a tough position actually.
Now, I will continue with the recommendation and the government action in solving the issues of supply and demand during pandemic COVID-19. As well known, in 2019, the COVID-19 outbreak hit all the country all over the world including Malaysia. It has affected the global economy that caused impact on a lot of things like supply and demand, supply chain, bankruptcies, plummeting stock markets and also unemployment. Indirectly, it has caused an unimaginable amount of damage of the country and globally. So, how can the government overcome this problem that occur? As for now, I will focus and discuss on how to overcome the issue of supply and demand on some industries like medical and healthcare, gold, online business, and food supplies. Okay, the first way that the government can do is prediction. Prediction is very important, especially to predict what will happen in the future. It can be done by looking at the data and the economic market when the pandemic outbreak happened. For example, in medical and healthcare, we can see that most of the hospitals need to face the shortage of staff and healthcare for the patients, such as the capacity of intensive care units (ICU), face masks, and also acute materials. So, ways to overcome it is just by using the system of early discharge. Especially for the patient that have some improvement on their health. It is because we don't know how many patients that is critical and need to use the ICU later. Besides, as for the acute materials, the hospital that have the surplus of material can give it and share it with another health institution that lack of acute materials. In result, it can reduce the problem that occur of supply and demand in medical and healthcare. The next is the determination of price on gold. As we know, the price of gold is determined according to the current situation. Basically here, I think that the pounding institution need to take initiative by providing some information about the product and also the current price of the gold to the customers. It is because to make sure that the customers can make decision on what product of gold that they're able to buy based on their needs. Indirectly, it will be easier for the customer to make a choice. Then, cost reducing. We can see this in supply and demand on online business. If we hear of the word online, of course everything is done by using internet, right? So, I think that the government need to reduce the cost for the internet access. It is because to make it more easier for people to buy anything online, since it's quite hard for people to go anywhere after this outbreak, especially for online business seller. They need to find raw materials for their business in affordable price, but sometimes it can be found at a far away from their state where it's hard for them to get it. So, cost reducing on internet access is needed so that they can find the things they want easily. The last one is the establishment of a crisis committee. As we know, this pandemic has led to lack of raw material which is essential for human, and it also makes the rate of unemployment going high. Because of this, the government has established the crisis committee so they can solve the problem quickly. What they need to do is to think about the solution to reduce the impact of food cuts and agricultural production so it will not affect the human needs. Among the examples that we can see is from Turkey. Their Ministry of Agriculture and Forestry has established COVID-19 Commission to overcome the impending crisis. By doing that, any problem or crisis that occurred during the pandemic will be identified immediately. As for the conclusion, we can see that the pandemic COVID-19 has caused difficulties in supply and demand, along with the supply chain in the country, especially in medical and healthcare, online business, food supplies, and also gold. Most of the problems that occur is very important in our daily life because it is our necessity. like medical and healthcare. If there are lack of supply and demand, it will cause people to easily be infected with the virus, especially the high-risk one like children, senior citizens, and also the sickness people. Then, what will happen if we lack of food supplies? Of course, it will lead people to starve and eventually die of starvation. Can you see how serious the problem is? So, who is responsible to find a solution for this problem? For sure, it's government, right? The government is one of the parties that is responsible in figuring out ways to overcome the impact of supply and demand during this pandemic COVID-19. They need to make sure that the country will recover sooner in order to make the economy will become like what it should be. Because without a stable economy, the country will be collapsed and also paralyzed. So that's all from us. Thank you.